All right, let's see. All right. Okay, there we go. I was having technical difficulties before, but we are back live. So give us 2 more minutes. Share this video with your friends, your family. Today we're talking about healthcare. All right. So when you think about what is, we just got a new president. There are some uncertainties as it relates to the Affordable Care Act or Obamacare. And so I wanted to talk about that. Let's talk about how do you save money on health insurance during these uncertain times. So share this video, and I will do the same. All right. So thank you so much for tuning in to this week's episode of Money Mondays with Ash Cash, brought to you by Bank Mobile, an all-digital app that gives you a financially empowering banking experience. So every Monday at 12 p.m., we go live here on Facebook. Make sure you tell a friend to tell a friend, you tune in, because we are giving you great information. And so today, I wanted to talk about health insurance. And so what we're discussing is ways to save on health insurance despite these uncertain times. January 2nd or January 20th, we recently have been appointed, or we elected a new president. And so Donald Trump, President Trump, is now our president. And there's been a lot of talk about what's going to happen with the Affordable Care Act or Obamacare. The first steps have been taken in order to repeal the Affordable Care Act or Obamacare. And so I wanted to talk today about health insurance, right? So, we don't know what's going to happen. We don't know, what the future of the Affordable Care Act, what is it going to do for public insurance, for private insurance, what is it going to be replaced with? So we're definitely living in some uncertain times. We just don't know, right? It's not good or bad. It's just, we just don't know. And then so I wanted to give you some tips on how do you save money on your health insurance, regardless whether you go public or private. How do you save money? So I want to give you 12 steps. So this is a 12-step program, if you will, around how do you save money on health insurance. So the first thing is to shop around for the right insurance policy. And so everybody has different situations, and depending on what your situation is will determine what type of health insurance you need. There are tons of different options. You can see whether you have a high deductible, low deductible. Some have clauses for pre-existing conditions, and based on your health how often you're going to go to the doctor. So make sure that you are shopping around and taking a look at your health insurance and determining what is the best health insurance based on your situation, right? So, one size does not fit all. Some people have, different ways or different things that affect their health. And so you can't just, ask your neighbor or ask somebody you work with, or just go based on what you think is, right for someone else. You have to take a look at what are your particular needs, and make sure that you're choosing the right insurance that's good for you. The reason why that's important as it relates to saving money is because if you are not using the right insurance, if you don't have the right health insurance, you can be overpaying for things. You could be overpaying on your deductibles. You could be overpaying on your insurance premium. You could be overpaying on medicine. There's just so many different things that come with that come with choosing health insurance that you want to make sure you choose the right one. Then once you make your choice, number two is you need to understand your policy. You have to understand what does your policy cover, what doesn't your policy cover, what is out of pocket, what is not out of pocket, what are your deductibles, and that's really important to know, because if you are somebody who has let's say a certain, something, you may have a pre-existing condition, or you may have something that requires you to be at the doctor often. So you want to be sure to plan that out, to know exactly how much is it going to cost for you to use your policy. So you have to understand your policy fully. Then I would say number three is spend more to save more. And that might sound, a little crazy, right? People might say, how can I spend more to save more? And that really, is a tip based on those who have, great need, right? So if you're going to be at the doctor a lot, sometimes you may want to choose, something that has a higher premium that's going to cover you, so that way you have less out-of-pocket expenses. You may want to choose something that has a high deductible, because the high deductible, helps you a lot. So, you want to make sure that you choose something that is going to help you save more. Then you want to make sure that you shop around for medication. And I'm going to pause for 1 second because, I'm in a co-working space and we have booked a room, but I think that there might be some miscommunication with the room. So give me 1 second as I get this. Are you booked in 10B? Because I booked till 12:30.
I booked from noon to 1:30 in 10B.
10B? Okay. All right, all right, cool. I just have to...
I would cancel it if I could remember. I think
No, it's fine. It's fine. Let me just, that's all right. Let me just find out.
you were on a roll there.
Yeah. No, let me just find out what's happening. All right, give me a second. That's all good. Yeah, thanks.
Thank you.
No, it's all good. All right, so we have booked. All right, so we're just gonna sort of like impromptu. My apologies, because we had the room booked, and I got to find out. I'm not gonna stop, but I'm gonna find out what happened. But yeah, so number. So number 4 is you have to be able to shop around for your medication, and shopping around for medication is important because a lot of times when you are going to the doctor and you have medication, there are the name brand medications that are going to cost a lot of money, but if you shop around, you do some shopping around, you'll see that there are maybe the same type of medicine that you would normally pay a lot of money for. There might be a generic brand. There might be the same brand that you're looking for that's a little cheaper. We know the major brand pharmacies, but there are some mom and pop pharmacies out there that may be cheaper. So just make sure that you're just shopping around for your medication, especially when you think about being sick and you think about being at a point where you just have this ailment, and your doctor says, hey, take this medication, and because you have this medication, you're saying, because you have this ailment, you're saying, all right, I'm gonna take this medication right now, and so you have to make sure that you are not letting your emotions, not letting your emotions make you feel like, you know what, I have to just buy it immediately. Take your time and shop around. The next one is to make sure that the test, prescription, and procedures are really necessary, right? There's some, again, being sick, health insurance, there are, a lot of times when we think about our health, it's really personal. We want to live, right? And then so health, not being healthy, can be the opposite of living, right? And so when we hear these, the doctor tell us, hey, we should do this test, or you should take this prescription, or you should do certain things. Just make sure that it's necessary, meaning that it might be getting a second opinion, but just make sure that the test that you're doing is necessary, because you could be, and I could tell you from experience, having going to the doctor for one thing, and then they start to refer me to these different places and tell me go here, go there, and I wind up getting this big medical bill for stuff that wasn't even really necessary. It was them, and I don't want to say that it was malicious, but you have to think that it is a business, right? That doctors do get paid based on, how many patients they have. And so sometimes, them referring you to a specialist might be in good intention, but at the same time, it may also be a way for them to make money. And so you want to make sure that what they're telling you to do is necessary. It might just take asking more questions. It might also take you just getting a second opinion, but just make sure that before you go through something that's expensive, that you are getting a second opinion. Next, you want to find out any upfront costs. I'll give you another example. One time, I had a situation with my back. I'm still trying to be a ball player, so I used to play ball back in the day. So I still play basketball, and I started to have a lower, like a pain in my back. And then so I went to go see the doctor, and I knew what the pain was coming from. It was from playing basketball, but it was also the how I was sitting, laying down, things of that nature. But when I went to the doctor referred me to a podiatrist, and the podiatrist was like, "Oh, look at your feet. Your feet are flat, and you should get these special shoes because that's what's going to help your back." So I was like, "All right, let me do it." And so I wound up doing it, and I didn't ask for upfront costs, but my health insurance didn't really cover the shoes that they referred to me. So I wound up paying $450 out of pocket for shoes that I didn't really need. And that goes back to my other point, is make sure that it's necessary. But I didn't really need the shoes because that wasn't the issue. So I wound up going to a different doctor. And started doing therapy and working out more on the core and working out my back, and the back pains are not there anymore. And so just make sure that what the upfront costs are, because the upfront costs are important. Then I would say pick the right facility. And that's important, because if you need a general doctor and you go to a specialist, or if you have a non-emergency and you get an emergency room, there are different costs associated with each of those types of facilities that you use. So make sure that you're picking the right facility. You want to check. The next step is also checking bills and insurance company statements for errors. We a lot of times want to rely on the doctor, our bills, and things of that nature, but sometimes there are errors that happen. So you might be paying for something that you're not even supposed to pay for. You might have insurance. Your insurance may cover a procedure, but they're saying, oh, you owe X amount of money. So make sure that you are always checking your bill, your statement for any errors, because errors can cost you a lot, especially and that's another thing, because they say 7 out of 10 credit reports have errors. And most of those errors come from medical bills. And I didn't misstate that. I'm saying 7. So 70% of credit reports have errors, and most of those errors come from medical bills. So there are a lot of times that you may have a bill that you don't even owe. You were covered, but because you think of the environment that the hospital is in, right? It's an environment of high stress. People are always, it's fast moving. Things are happening. People are eager. And so when that happens, the people who are charging the bills, they make errors. So make sure that you're checking for errors. You want to get a copy of all medical test results and records, because again, you don't want something to pop up 2 years later, 3 years later, 5 years later. I know I don't remember what happened last year, and so if I don't have a record of it, someone could be potentially trying to charge me for something they're not supposed to charge me for. I would also, and this is another way to save money on health insurance, and this is number 10, is take advantage of any free screenings. I know I do. I don't want to just tell other people that they do this, but a lot of times there are free screenings, and I have this chip on my shoulder where it's like, oh, you got free screenings for whatever, and I'm like, I don't need that. I have health insurance, but if I use my health insurance, I'm going to be paying for it, whether it's through a deductible, whether it is using up credits that I may have in my health insurance. So taking advantage of free screenings is not necessarily a bad thing. It's actually a good thing to do, because when you do take advantage of free screenings, you are able to save money on your health insurance. Number 11, negotiate any medical bills, any big medical bills, right? Again, the doctor, it's a business, and sometimes we forget that. Sometimes we think that what they're doing is altruistic, and they're doing it from the kindness of their hearts. They just want to help the world. But the honest to God truth is that health insurance is really, or the medical field, pharmaceutical field, all of that stuff is a business. And so when you think from a business perspective, anything is negotiable. Anything is negotiable. So, back to a previous point that I made, is that you have to, that you have to check, the upfront cost. And once you know what the upfront costs are, it is important that if it's something that you have to pay out of pocket, that you go before you actually do it, or even after you do it, that you try to negotiate your medical bills, because that's something that you can do. And then lastly, this is I should have said this first, but this is a really, really important way to save money on health insurance, especially in these uncertain times, is don't get sick, right? And I know you're like, don't get sick. Well, how can I not get sick? There are some preventative things that you can do. There are some, preventative measures to help you in the process of not getting sick. So make sure that you're taking those precautions. So whether it is being mindful of the food that you're eating, right? Being mindful that when you eat, you have to eat for nourishment of your body, not just to say, hey, I'm going to eat because I enjoy eating, right? And you can enjoy eating, but just make sure that the food that you're putting in your body is healthy, and that it's helping your body stay strong. Exercising, and it's not, I'm one to tell you that I have a busy schedule. I'm always on the run. I'm always on the go, and so sometimes it's really, really difficult for me to get to a gym. But one thing that me and my colleagues have done in our office space is that we actually every now and then we just drop down and do some push-ups, or every now and then we walk up the steps. Our office is on the 10th floor. We walk up the steps and do certain things that allow us to stay healthy. So not getting sick is about preventing you going to the doctor. Eating fruits and vegetables, right? So they say apple a day keeps the doctor away. It's true, right? More than an apple, but there are ways to keep the doctor away. So just make sure that you are using the preventative measures in order to not get sick. All right, so let me give you a quick recap of the 12 ways that you can save money on health insurance. Number one, shop around for the right insurance. Make sure that you have the right life insurance or health insurance. Number two, understand your policy, know what your deductibles are. Number three, spend more to save more. So sometimes having a high deductible or having a plan that you pay more in premiums can save you more in the long run. Number four, shop around for medication. So don't always just go with the place that's going to give you your medication, like the big brands. Shop around for it. Number five, make sure that the tests, prescriptions, or procedures are really necessary. Number six, find out any upfront costs that you may have. Number seven, pick the right facility. Don't use a emergency room for a non-emergency room. Number eight, check your bills and insurance company, or check your records for any errors. Number nine, get a copy of your medical tests and records so that nothing comes up inadvertently. Number 10, take advantage of any free screenings that are available, so that way you don't have to pay any deductibles. Number 11, negotiate medical bills. So any big bills that you have, any big medical bills that you have, you can negotiate those. And then lastly, take some preventative measures to not get sick. You take these preventative measures, it will really help you so that you won't get sick. So that's my time. If you have any questions, make sure you email me, ashcash@bankmobile.com. I'm here live every Monday at 12 p.m. And also shoot me an email. Let me know, what topics you want to hear. So every time I kind of just take a look at what's happening, and then based on what's happening out in the world, make a decision on saying, all right, this is what's happening. This is what might be beneficial. So make sure you email me, ashcash@bankmobile.com, and let me know what is it that you want me to talk about every Monday, 12 p.m., Money Mondays with Ash Cash, brought to you by Bank Mobile. If you haven't downloaded our app yet, make sure you do so, bankmobile.com. And I'll see you next week. Same time, same place. Thank you so much.